Welcome to video 5 for chapter 9, joints for anatomy and physiology. So we are going to look at the different types of synovial joints and give several examples. So one way that we can categorize synovial joints is based on how many axes of movement we have in a joint. So we have uniaxial, biaxial, and multiaxial. So these are fairly easy to look at because of the prefixes. So uniaxial, we have one axis of motion. Biaxial, we have two axes of motion. And multi-axial, we have more than two axes of motion. So we'll use these terms when we describe these. So you can look down here at the diagram and see that some of them have one set of arrows, some of them have two, some of them have more than two. So that's one way we can look at these. And this diagram gives you one specific example where these are located, and I will give you probably a couple more. So our first one right there is called a pivot, which kind of reminds me of an episode of Friends if you're a fan. So this is a pivot joint. So with a pivot joint, we have rotation around a single axis. So this is pointing towards the neck. So with the neck, we can have rotation around. As we move our neck, it pivots from one area to another. So it's just turning. So this would be neck vertebrae. So that's our good example. We also have somewhat of a pivot between a radius and ulna, but it might not be the best example because if you remember when we turned our hand like this, it kind of pivots around there, but it's a modified pivot. So the best example of that would be with the neck vertebrae. This joint right here, the elbow, is a very good example of a hinge joint. This is also uniaxial because we have motion along one axis. So good examples of this, we have the knee, we have the elbow, and we have the fingers and toes. So each finger we have multiple hinge joints because we are moving. This joint can move, and then this joint here, we can move it back and forth. So it's a hinge, just like our elbow. So we have a lot of hinge joints in our body, but again, it's uniaxial, as is the pivot. Now, this joint is unique, and it's showing you here around the thumb and wrist. This is called a saddle joint. So it kind of looks like a saddle that you would have on if you were horseback riding. And this is biaxial. So we have two different planes of motion. And it has a right angle orientation. So this is biaxial with a right angle orientation. And this is where our opposable thumbs come into place because we can move our thumb like this, but we can also move it up and down. So we have two planes of motion for our thumb. And it's due to the metacarpal 1 to one of the carpal bones. We don't have to worry about which one it is, but just know that it is our thumb hand bone. This bone right here allows us to move our whole thumb. So it's this joint right here that you can feel that has that motion with the right angle orientation. As we're going over here we have another biaxial. This is called a plane or gliding joint. Sometimes it's limited with being biaxial, and sometimes these are uni or bi, depending on where they're located. But good examples of this are going to be in the wrist and ankles. So those bones, they don't have a lot of movement, but they can move past one another, and it gives us motion that's like a gliding motion in multiple directions. We also have limited movement in some of the vertebrae, especially in lumbar, where we can move a little bit. So we can have this in the thoracic and lumbar vertebrae also. So we can't fully rotate like we did with a pivot. So they're kind of like a plane pivot hybrid. This joint goes by two different names. So I've seen it as two different names. I've seen it as an ellipsoid or a condyloid joint. This again, biaxial. And this is limited rotation. So some of the ulna and radius, mainly the radius and wrist, that's one example. Another example would be the temporomandibular joint. So we can move our lower jaw almost in a rotation manner, but it's not quite a full rotation. We also have this with the occipital bone to the axis. So we have a limited rotation with that when we do the no motion. And then we have our one multi-axial, which is the ball and socket joint. And this is exemplified by the hip and the shoulder. So all of these are examples of different joints within the body, different synovial joints.